What's going on, everybody? Wilson here, spiritual hype man, and we got Dr. Lisa over here. Dr. Lisa. Doc, before we start, can you just specifically tell them, in case there's people out there trying to fact check us about the doctor's part, to give us who you are, what you do, and all those credentials that make you super important, and the reason why I'm here.
Oh, great.
Other than being awesome.
Well, yes, of course. I'm Dr. Lisa Magary, nurse practitioner. I have a clinical doctorate from UF, so it's a DNP, so I'm officially Dr. Lisa NP. I have a membership-based primary care program here in Palm Coast. I'll be opening in Gainesville in January of 2025, and I love what I do because I actually get to help patients individually improve their health, and I help them reach that through holistic ways. We do use medication, but we kind of use it as a Band-Aid until we can get all the way better. And I love helping people get better and feel great as they age, because I think all of us kind of feel we get old and things are just going to be bad, but it doesn't have to be that way if you do the right things.
Absolutely not, Doc. You know why? Because I'm 28 years old.
And still going backwards.
That's right.
Still going backwards.
That's the goal. And,
Nope.
Doc, you're helping.
Oh yeah, I love it. It's my favorite.
So real quick, also, when I met Dr. Lisa, like I've had experiences in the medical world around when I just had to go to a primary, obviously under insurance or whatnot. But I felt that they didn't listen. Like I was just sort of.
And it's not their fault.
And it's not.
They have 7 minutes. It's
right.
The insurance model. It doesn't promote health. It's all about, you have a problem, here's a prescription. You have a problem, here's a referral.
Yep.
So I will refer you if you need to be referred, but we're going to do all the things we can before it gets to that point.
100%. And that's when we met, and the first conversation, you're like, yeah, I've done this, I've done that, I've done the ice bath, the plunges, the healthy
I know,
diet.
you were just like, what about this? I'm like, yeah, I've been there.
Yeah.
What about this? Oh, I've done that.
Exactly.
You know?
And then that was it. Like, I was like, I knew that you were the person to then help me. But like, I was looking for someone to be able to help me and like provide the answers that I was looking for. When it came to my health.
Or at least rabbit hole with you and like look into stuff like,
exactly.
I don't really know about that, Wilson, but let's figure it out together,
exactly.
You know? Because I tell people all the time, I don't know everything. Like, I learn from my freaking patients every day, and I love that. I'm like, teach me something. You're not gonna come and hurt my ego because I don't know anything. I can't know everything. Right. Like, please. Like, I have a patient who's like, oh, I do seed cycling to balance my hormones. I'm like, what is that? It's like a combination of seeds that, during women's menstrual, like, they need different nutrients, and these seeds help. And like, I've never heard of it. Teach me. I want to learn,
Exactly.
And maybe I can, somebody else who wants to try something more natural, like, hey, let's do this. So I'm very open. Like, I don't know everything. No one can know everything. That's and right. So I love learning with my patients and trying to help guide them. It's fun.
Yeah, which is great, and that's why we're here. Yeah. So a couple months ago, I think it was back in September or something like that? September, I did initial blood work. The blood work came in, and then I had a couple more advanced tests, which we're going to share with other people why. Obviously, my goal is to reverse age, right? Yeah. To continue to reverse age.
But you had labs a long time ago when you first met.
I did. We had labs the first time. So between those labs and the labs now, there was definitely some improvements, definitely some change. So let's just kind of go over it. We'll share with people what they are, each component, give a little tidbit, and then some of the things obviously that got flagged. Let's talk about that, and then give me some suggestions, because then we're going to create definitely a protocol, some supplements, things like that we're going to introduce. And then from there, then we're going to do a retest and see where I'm at.
Yeah, I love it.
Cool. Let's take it away, Doc.
Okay, so on our panel from Quest, the first was the lipid panel. Your cholesterol is good. It's like 192. Your HDL is 61, and your triglycerides are 52. That is really, really good. Okay. But I would like your HDL a little bit higher. Okay. And the things you can do, which you're exercising already, so that's one thing to raise HDL. Another is good fats. Okay. Avocado oil, eggs, animal fats. Yeah. I know people are going to be freaking out about that. Right. Olive oil, olives, nuts. Those are all good fats.
Now, stay away from what type of fat then? Like French fry oil fat?
Yes, like any processed fats are not going to help you. It's actually going to make things worse. Okay. So any canola, any vegetable oils, not good. Anything, eating out is the worst for us because there is no good fats involved in eating out. Right. Like back in the day, they cooked French fries like at McDonald's in beef lard.
Yeah, right.
Those were so good for you.
Exactly.
Like peanut oil is actually okay. Yeah. Like on the spectrum, it's so much better than like canola oil, but or any of those highly processed oils. But in general, if you can stay away from the processed oils and eat the whole real stuff, that's going to be best.
Yeah, and I think that since seeing that, I think the biggest thing is like, okay, when I go out, I don't order the French fries.
Right.
I try to stay away from it because I think that those are the biggest things. That and cheeseburgers, like cheeseburgers are like the thing.
Well, cheeseburgers not bad except for the cheese they put on them.
Exactly. Okay.
And then the butter they put on the butter,
right.
the butter that's not butter that they put on the bun, like but burgers are great.
Okay.
Eat your burgers all day long.
Cool.
It's just
it's
the fake cheese and the fake butter.
Okay, cool. So better oils on there, avocado, stuff like that. Stay away from all the junk oil, basically.
Yeah, pretty much.
Okay, cool.
Yeah,
awesome.
anything highly processed. High sensitive CRP, yours is less than 0.2, which is great. That's an indirect marker of inflammation. So even if it was elevated, it'd be like, why is it elevated? I don't really know. There's 7 million things.
Right.
Stress can raise your
Stress,
food, like not sleeping, autoimmune diseases. There's a gazillion things that could cause it. So I like to look at it and track it when someone's making changes. If it's elevated in someone, we make changes and see if we can move that needle and move it down a little bit.
And that's an inflammation marker.
Yes.
Okay.
Yeah.
Very cool.
High sensitive CRP. Yours is great.
Can I talk about that too? Like I stopped drinking a lot, like especially beer.
Yeah.
And again, I don't know, if we were to go back where that would be, but it's kind of low, right?
Yeah, it's great.
But beer was always an issue for me. So like when I would drink, even in the evening times, and if it was beer, I would wake up feeling very cracky, and I would go like I can feel it now. Not at all. Yeah,
that's awesome.
Yeah, which is great. So side note.
Even with your red wine the other night.
Mm-hmm. Even with the red wine, like I switched over to red wine.
I love red wine.
Yeah.
Next is homocysteine, which is another kind of inflammation thing.
Okay.
Yours is normal. Yours is 10.6. Sometimes I like it a little bit lower, but sometimes if we get you on a good methylated B complex vitamin, it can bring that down.
Okay.
So high homocysteine is also connected to heart attacks, so we want that to be low. So I check them on people.
I was within range.
Yeah.
Okay.
You're good. Next is comprehensive metabolic panel. Your fasting sugar was 86, under 90 is great. Cool. Liver kidney function was good. Your ALT, which is your liver function test, was at 22. I like it in the teens. Okay. But if you'd had any alcohol in the previous 3 days, that kind of can raise your liver test.
And that's the liver. Yeah, I wonder how much of that is also like the supplements I'm taking and like how often I like cycle off or cycle on.
Yeah, it can impact that for sure.
Can impact that. Mm-hmm. Yeah, I'd love to. Okay, so that'd be something I want to just keep an eye on.
Yeah. I mean, it's in the normal range, but optimal is in the teens.
Yeah, we want to optimize it. Okay,
yeah.
okay.
Optimal's in the teens.
Teens, got it.
Okay.
And that's just liver function.
Yeah, everything else was great on that. Everything else was good, normal. Hemoglobin A1C, that's your average 3-month blood sugars. Yours is 5.5. Anything above 5.7 is considered prediabetes, so you're in the normal range.
Okay, cool. I would say I think a year or two ago, I was in the pre-diabetic. Yeah. And I noticed those sugars, right? Yep. Sugars are crazy. Mm-hmm. Yep. I stopped eating bags of Skittles.
I wonder if that moved the needle any. Yes. Yeah.
Okay.
Like straight sugar, no bueno.
Yeah, not good at all. Okay, cool.
No, and I tell people it's not an all or none thing, but like it's a treat, not a daily situation.
Yeah, for sure.
Your magnesium was great in normal range. Your thyroid.
Wait, can I ask, what's the importance of magnesium? Because I do use that as a supplement, and I know that's super important.
Oh yeah, magnesium. I mean, it's a cofactor in a lot of chemical reactions in our body.
Yeah.
So, for the powerhouse of the cell, the mitochondria, you need magnesium. So for people there's a lot of different. We could talk about magnesium for like 7 million days, but there's different magnesiums for different functions. Yeah. There's some that cross the blood-brain barrier. There's some that are better for sleep. There are some.
She knows what she's talking about.
There are some.
That was a test, Doc. That was a test.
I was like, there's magnesium that will help clean you out. Yeah, so there's different magnesiums, and what you get at the store, magnesium oxide isn't really very bioavailable. 100%. So it depends on if you want magnesium for neurologic function, you need threonate. If you want magnesium for helps with sleep, glycinate. So it depends on. There's citrate if you really want to get a clean out. That's a good one. So different magnesiums affect the body differently.
Yeah, and definitely one of the most important parts of the supplemental.
Because our food used to have magnesium because it would be in the soil, but there's it's been stripped.
Depleted. Wow.
Yeah, it's depleted. Wow. So vegetables that you get from your local farmer or somebody who's got like a small garden, you're going to have a better chance of having magnesium and more nutrients, but the soil has been pretty stripped from the traditional what you get at the grocery store.
And something to cycle off or not cycle off because you don't really
forever.
need to, right? It's something you can keep taking, right?
Yeah.
Great.
All right. Next is thyroid.
Okay.
Your TSH is 1.6. We like it to be 1.5 to 2.5. That's perfect. Your free T3, which is the active form of thyroid, is I never measure. I don't really measure free T4 because it's the inactive form. I like to see if it's high and your free T3 is low because that means you're not converting. That means stress can lock up your T3 and make it so T3 is what keeps your metabolism going, your hair growing, your bowels moving, those kind of things. And so your temperature regulated, all those things. And so I want your free T3 to be, 3.5 to 4.5. Yours is fine at 3.3. Your other numbers are great. Okay. So I wouldn't do anything. Your reverse T3, which is what binds up T3, is fine.
Okay.
So.
But it's on the lower end of it?
Yeah.
Okay.
Well, it's not on the lower end. It's at the lower of optimal. Like, if you were 2.3, I would be like, ooh, listen, that's too low. Like, got it. Even if your TSH is normal.
Okay.
So, I could go into the thyroid stuff for it all day too.
So give me like a little, like give me, I guess, like an example of, maybe a little more simple for me, just an example of like, okay, so I got, the way I see it is T3 and T4?
Yeah.
Okay.
Well, there's TSH,
okay,
thyroid stimulating hormone.
Okay.
When your T4, which is inactive, gets low,
gets too low, it stops.
TSH comes up, telling your body that you need more T4 because it wants to convert it to T3.
Got it.
Some people don't convert because of stress and our active life and our lifestyle we have now. So when your TSH is high, that means your thyroid function is low.
Which then stops all these other functions.
And then you have all this problem.
And that's where people have like thyroid issues.
Weight gain. They lose the hair here on their eyebrows. They are constipated. Their hair's falling out. They feel like they've been hit by a semi. Their body temperature runs low. So I mean, I could talk about that
for sure.
for a lot. But so, I mean, yours is overall fine. Yeah.
How do I make it better? Less stress? Does stress play to it?
Less stress. I mean, there's a lot of factors. There's bromide in bread. There's fluoride in water. That competes for iodine on the thyroid receptor. So minimizing, processed foods is going to be helpful.
100%.
Not having fluoride in your water is helpful.
Okay.
So, and taking an iodine supplement. The problem is people are like, oh, I have fluoride in my water and I eat bread, so I need to take iodine. And then they take it and then they feel worse. And the reason is you can get bromide and fluoride toxicity because you're not getting it off the receptor. And so then you don't feel good. You're like, oh, I can't take iodine. I don't feel good. I'm like, yeah, you can't start at the dose on the bottle. Like you have to start low. So as you're kicking it off, it's being replaced, but you're not doing a mass exodus.
Okay, I gotcha.
Because it likes iodine better, right? And we used to eat more fish, we used to eat more seafood, and so we didn't, and there wasn't fluoride in the water, and there wasn't bromide in bread, right? So now our lifestyle has pushed all the, we don't, there's no room, there's no iodine in our diet, there's not enough anyway, which is why they added iodine to salt.
Okay, I get it, now that makes sense.
I mean, I told you.
Yeah, we'll go all the way in.
Yeah, so we don't, but now people don't eat the iodized salt because of salt. Because it's been stripped of everything, so everybody's that is trying to live a healthy lifestyle is doing Celtic salt or Himalayan peak salt, and that's not processed salt, so there's no iodine in that either.
Wow. Okay. So definitely something to consider if again these test results show. Okay, I think mine is stress. So
you think?
I'm gonna do more.
I think all of us.
More mindfulness, but okay. Yeah. So I'm okay.
And you don't have any antibodies to your thyroid, which is good. That's another thing that can cause problems for people. Okay. And that's a lot of times related to gluten in the diet or dairy in the diet. You have an intolerance and it's creating antibodies to your thyroid. You don't have that.
Fantastic.
That's another conversation that we don't have to have.
Yeah, we'll keep going. That'll be on the next one.
Okay. So next is your CBC, which is your complete blood count.
Okay.
Your cells are, your ferritin is okay, but your MCHC is a little bit low, and that has to do with the size and color of your red blood cells. So I would say, even though your ferritin's good, probably, do you eat red meat?
So, yes, but probably not as much as I should, I don't think.
Yeah. So where's your ferritin? Your ferritin's 100, which is fine. That's adequate.
What's optimal there in terms of ferritin?
For women, if I can get them above 50, if they're menstruating, that's great. Men, I like them at about 150.
150. Okay.
Yeah. So it's just red meat, cast iron skillet. Those are natural.
I got the cast iron skillet.
oysters
Okay.
and mussels.
Okay.
Those are the best natural sources.
For ferritin.
For iron.
For iron.
Yeah.
Which then, okay.
And the stores is ferritin, so I check your iron stores, which is your ferritin level.
Okay.
Your total iron was fine. It was 95. I mean, all of it's fine. It's just, a little bit more.
Okay.
Yeah. Your B12 was 359. I like it above 500. I tell people, as we age, we have less intrinsic factor, which is what turns the B12 we get into our stomach, into our cells.
Into your blood system.
Yeah. And so I tell people if they're going to take B12 to take it sublingual.
Okay.
Because if you don't have intrinsic factor, your stomach acid is destroying it before you even get to absorb it properly.
Oh, wow. Okay.
So I tell people drops or injections or sublingual on your B12.
Okay.
Because they're like, oh, I have B12 in my multi. I'm like, well, if you don't have intrinsic factor, which is why you were low in the first place, it doesn't matter. Your stomach acid and you're not gonna you're not gonna have access to B12.
That's funny. I wonder. I'd be curious. I'm really curious now to do the other blood, like recently, based on some of the things that I've changed. But I've taken a B complex. I've had an issue swallowing pills for the longest. I realized, well, I know why, because I used to have those strictures in my throat.
Yeah.
And so now, like, psychologically, I can't do that, and I have to like have powders and stuff. So I've been doing like a B complex, a high quality B complex. So hopefully, I don't know, we'll see.
We'll see.
But if not, then the sublingual right underneath. Okay,
yeah,
cool.
the drops or there's a tablet that like kind of melts under your tongue.
Yeah, fantastic. All right, cool. Nice.
All right. Next, we talked about ferritin is fine. B12 is a little low. Your DHEA, which is a precursor to hormones, is in a good range. Your insulin, I like it less than 5. Yours is 3.2.
Let's go.
That's awesome. Your estradiol, I like it less than 35. Yours is 32.
Let's go.
And
what is estradiol?
Okay, so men are like, we have estradiol? Yes. Yeah. And you can get menopause too.
That's right. Right, Patty?
So what happens sometimes, especially in overweight men, is because they have belly fat, their body makes more estrogen. And so then they have a hard time losing weight because their estrogen's too high for a man. And sometimes clinicians that know a little bit will be like, oh, take some DHEA.
Yeah.
But it's a precursor to estrogen and testosterone, and you don't know the pathway it's going to take. So I'm very cautious on telling people to take DHEA.
Yeah.
I'm more of like, let's attack the direct thing. So for men, if their estrogen's too high, I put them on DIM. And sometimes that'll bring it down as a supplement. And if that doesn't work, I put them on an estrogen blocker, and so we can get it to a lower level.
Fantastic. And then get that kick started.
Yeah.
Okay.
And sometimes men just turn their testosterone into estrogen because of stress, and I can't fix it. So they just have to take a blocker.
Stress is crazy, huh?
I could tell you a bit on these labs how many things are directly related to the stress.
That's funny. So you come in, you're pretty much stressed.
Yeah, meditation,
right.
exercise, fun, hobbies.
That's right.
Yeah.
Take
a vacation.
Yeah, that's right.
But meditation, get your mind right. I talk about counseling, 100%. NLP. There's all kinds of things. So your testosterone is up to 807. Can you talk about that?
Yeah. Okay. So the first time we came and did blood work, we did the testosterone test, and I was at 500, right? And I was like, oh man.
Wilson, tell the audience how old you are.
I'm 28 years old.
Lies.
Okay.
But still.
Okay. I'm definitely not 28. I'm definitely on that. I want people to guess. I want them to keep.
Oh my gosh. Okay.
But it's definitely a couple years higher than that, right?
Yeah.
And so when I first got here, when we first did the test, it was 500, and basically it's right in the middle, right? Between
but 500 you won't feel good.
Yeah, 500 you're still low. Like it's still low.
Low.
It's still considered low.
Not by the normals, but by being optimal.
Being optimal, low. Yeah, where you feel great. Like I just feel fucking amazing. Right? Let me just tell you what I feel.
And it's natural. You didn't take any. You didn't get
no
injections.
Yeah, no injections, nothing like that. Not that I would assume. Depending on the person.
Some people need it. They need injections or pellets or creams or whatever.
And that's fine. And to jumpstart to get you there. But Doc gave me a couple. Well, first I was like 500. I was like, I tried in my own head. I was like, maybe it's not so bad. I'm not really aggressive anymore. Like, I can see why I'm in between, in the middle.
Yeah.
But when we had the discussion, you're like, listen, just go do some man shit, man. Like, go take your shirt off, go, swing a hammer, go do something outside, start working out. And that's I started.
Sunlight on your skin.
Sunlight on the skin. Started doing that more and more. And then most recently, the last couple of weeks prior to the test, I committed to doing my minimums push-ups, minimum squats, and minimum pull-ups. Every day I hit them, no matter what. And some days I feel even like better, and I just like go in and I crush more. And so to come back and then see, and then again, I'm not 100% aware of the difference, like how big of that difference is. But when we shared it, how big is a 300-point difference?
That's huge. I mean, some people I can't get them to 800 on injections, like. So that's fantastic.
Yeah,
that's
let's
great.
go. So that makes me feel even better in terms of what we're doing, or like, you know, changing up and doing the outside stuff, getting the sun, getting the workout, and then committing to it. And I can feel it. Like I can feel, like I said, I feel fucking amazing. Like I can feel the difference, even on like playing soccer and doing what I do. Like there's no better feeling than someone trying to muscle me off the ball.
You're like,
and they
take that.
They go flying, right? They're like, I can't even. It's an amazing feature. So yeah, so I'm super excited for that. And I think for any men out there, like any guys who are listening, if that's something that you're looking to do, definitely talk to you about, you know, at least getting your test. I feel it's super important to get your test, figure out where you're at. You know, Doc will obviously give you pretty much the same thing. Let's say go outside, do some manly shit.
Yeah,
know,
get on some zinc, make sure your vitamin D's optimized, like do the
exactly.
things.
Come back, test it, and if you're still low, then you have other options, which I think will be great. So I'm super excited. I can't wait to. You know, I don't know. Can I continue to increase it? Probably,
sure.
right? Like
Why not?
If I wanted to.
Do it.
But okay.
Get to 1,000.
Yeah, we'll see.
I dare you.
Yeah, we'll see.
Do all that man stuff.
All right, cool.
The last thing was your vitamin D, which I like it to be 60 to 80, and you're 41.
I saw that. 60 to 80, wow. And I'm 41, so that's a little bit low. Even
Yeah.
though I go outside.
I know, but the tanner you are, the harder it is to make vitamin D.
Ah, gotcha. Okay.
And if you have any sunglasses, glasses, or contacts, that blocks vitamin D production because your receptors are in your eye.
Got it.
So I tell people go outside with a hat on, but don't wear sunglasses.
Right.
And they're like, I have to. I'm like, actually, I don't wear sunglasses. I have like light gray, green eyes, and I haven't worn sunglasses in 15 years since I learned about the sun.
Yeah. Fantastic.
I go, if I'm at the beach, I don't wear sunscreen, take off my glasses, put a hat on, 2 hours.
Get your vitamin D in. Okay. Yeah, cool. And I know you offer the ADK.
I have great ADK here. Because if you take vitamin D, you need to take enough, first of all, and you need